Hello, everybody. This lecture is going to be covering typical concerns related to the toddler. So, we're going to start with toilet training. Toilet training is a huge focus of the toddler years for parents who are ecstatic to stop changing diapers. The physiologic control of the sphincter happens after the child can walk, and it's really thought to happen between 18 and 24 months. However, in the US, only about half of toddlers are trained by the age of 36 months. So there's four general signs that we look for to show readiness to begin toilet training. There's no magical right age, but our job is to help parents to be able to recognize when their child's ready. So the signs of readiness are waking up dry from a nap or overnight, the child's awareness that they need to go, okay? The child being able to communicate their needs, and they're staying dry for at least 2 hours during the day. Now, nighttime bladder control comes much later than daytime control, and bedwetting is actually quite normal in girls up to about the age of 4 and about until the age of 5 years in boys. As an example, my daughter just turned 8 this summer, 2024, and she just stayed dry overnight in February at 7.5. Some of that was behavioral on her part, but nobody was concerned, and she's dry now and everything is fine. She's not going to high school wearing diapers, right? So there's a multitude of different methods that you can use to toilet train a child, but the most important part to remember is that we want to be positive and supportive with that child and supportive of the parent as the healthcare providers and nurses working with those families. You want to make the experience positive for that child, right? Children will have many more issues if they have a negative experience or there's a lot of shaming involved in toilet training. Intentional holding, for example, can lead to chronic constipation as kids get older. And this is often originated when shame is developed around those bowel movements. So, what about temper tantrums? So, the stage of toddlerhood that gives us this term is the terrible twos, right? Toddlers have very poor impulse control. They're also learning how to exert their own independence. So, as they try to practice this new skill, and then we tell them to stop something, they're not always able to stop that impulse to do it again, which leads to the parents getting frustrated. And a toddler gets frustrated as well, but that often comes out in violent objection. Okay. So tantrums can look very different depending on the kid. Some kids will lie down on the floor and scream. Other kids will run off. Some will even hold their breath. Now, I have actually never seen this in the wild, but children do tend to find this really effective because parents will get anxious when they're not breathing and will quickly give in to what they want so that that child will start breathing again. And then that reinforces the behavior. So the advice is actually to stay really firm because eventually that child will faint as their oxygen levels drop and their CO2 goes up. But as soon as this happens, they will start breathing again. And so it seems scary and harsh to allow this to happen, but it actually doesn't cause any long-term harm to the child, but it really is the only way to stop the behavior. There are hundreds of books on child behavior these days, as well as experts on social media. And much of it really boils down to the same ideas, right? We want to keep firm limits. We want to have developmentally appropriate expectations, right? A younger toddler doesn't have the language to express frustration, and so they will use behavior instead. Parents need to be consistent in their approach, right? Don't move those goalposts and to stay calm. A tantrum is just a good kid having a hard time. And our job as the adult is to model that regulation and guide them through those rough moments. So early on, this teaches them boundaries, right? And as they get older, it also teaches them that their emotions aren't out of control and unmanageable to the adults around them. So no, no, no. Okay. That is the frequent refrain of toddlers. And as frustrating as this can be to parents and caregivers, it is simply how they exert their own self-control. One way to help them to do this is to minimize the opportunity for them to say no. So don't ask a toddler if they want to do something that you need them to do, right? Do you want to go to preschool today? You've presented an opportunity now for them to say no. Let's be real. There are kids that will still say no. My child, my 8-year-old, is a perfect example of this. Choices never worked for her, even up until recently. Sometimes they will still say no, at which point then we go back to asserting those boundaries, right? And letting them know that certain things have to happen, but they have control in the way that they will happen. Definitely don't want to say, can we take your blood pressure, right? Because going back to that developmental stuff that we've been going over, taking something is very literal to a child, and they're going to think that you're actually removing something, right? Measure your blood pressure, test your blood pressure, any other thing like that. In the hospital, these kids have had this done usually by the time you care for them. So don't get super caught up on the language. These are guidelines, guys. Okay. You're not going to make or break anything by falling off script. I don't want you to be super stressed, but these are tools that you can have to help make those experiences go more smoothly. Okay. And that's not saying they won't be smooth if you mess up. They absolutely will be. Okay. But what you can do is say, you have to check your blood pressure now. Do you want to use your right arm or your left arm? And they can still make that choice and feel autonomous, and you're still getting what you need accomplished. Most importantly, never give a toddler an option that is not available. All right. Don't ask them if they want to do something if they have to do it. You are going to ruin the rapport that you have built with them. They aren't going to feel that they can trust you. So don't ask them if they want to take a medication or if they want to be assessed, because those things just have to happen. So giving them choices that are available to them instead is really important. Moving on to toddler nutrition. So this is really an age of exploration for these children, but also the age of very picky eaters. So this can be a really challenging age for parents because there's such a big change from the infant where they were open to more flavors at that time and it was really exciting and they wanted to try all these different foods and you were generally able to get them to do that. Toddlers will typically eat 3 meals a day and 2 snacks. So ideally, you want them to eat a variety of vegetables and fruits and proteins and whole grains following the My Plate guidance. But what typically happens is around 18 months of age, children don't actually need to eat as much. And so they have a decreased nutritional need. And then when they don't eat as much, parents get concerned, right? But it's normal for them to have what we will call physiologic anorexia. Okay. It's an important term to be familiar with. Hint, hint. They're just not as hungry at that age because they're starting to slow down their growth a little bit. And often around the same time, toddlers will also, because nothing is easy, become very picky with very strong preferences. So they become much more aware developmentally of those pleasure perks surrounding the social aspect of eating and the control that they have over what they eat. And they also can become really picky about things like which bowls or plates or cups that they use and not wanting food to touch on their plates. So it can be a really fun time for parents, if you can imagine. They should be able to drink from a cup at this point with minimal spilling by about 18 months of age. And they should be able to use spoons and forks, although they might still prefer to use their fingers because it's faster and easier. They need to be exposed to and be able to use those utensils. One way that you can also help encourage toddlers to eat is not serving large portions. There have actually been studies that show that if you give them smaller amounts, they're likely to ask for more and then eat more than if you start with the amount you want them to have and they're overwhelmed by the amount on their plate. So typically, we're looking at about a quarter to a third of an adult portion, and then that will prevent that feeling of overwhelm. Serving them diverse meals and allowing them some control also helps. You could ask them, would you like your broccoli on this side or this side of your plate? Having them serve themselves or help in the kitchen as far as being that developmentally appropriate and safe could also get them invested and have a little bit more buy-in into eating the food that's prepared. By this age, cow's milk usually becomes the main source of calcium and phosphorus. So from ages 1 to 2, children should consume about 2 to 3 servings of milk per day. But you don't want them to have more than about a quart, okay? Too much milk can lead to less eating of solid food because they don't feel hungry. It can also lead to iron deficiency anemia, which we'll talk more in depth in the hematology lecture later this semester. But it's very common for children of this age to overdrink dairy and milk, and then they will not eat those diverse amount of foods that we want them to eat. With that said, around the age of 2, we can transition from whole fat to low fat milk as their need for fats in their diet isn't as great.